talking today about sleep and answering some of your biggest questions. Like, is the snooze button really bad? And why do you wake up in the middle of the night? And what should you do when you do? Joining me now, Michael Breus, known as America's sleep doctor and author of The Power of When. He's here along with sleep expert, Dr. Carol Ash. Welcome to you both. Thank you so much for being here. All right, can we just start with the snooze button? Because we talked about that in our A block about, I do use it. Is it the devil?
It's like the worst invention ever.
It is, okay.
Yeah, the average snooze button is between 7 and 9 minutes long, and your body can't physically get back into deep sleep during that period of time. So when you hit the snooze button, you're just giving yourself light, crappy sleep.
Okay, but isn't that better than no sleep?
Well, here's the thing. I would rather you set the alarm for the last possible moment for you to wake up and then get up. But I do one. I give people a prescription for one snooze only if they have a tendency to be a night owl, where they go to bed very, very late and it's really mornings are really difficult for them. But I have them place their alarm clock across the room.
Yeah.
So they have to get up, go over there.
I'm in that category. I feel like I just got to pass. This is good for me.
Absolutely.
So I can do it. I can do it one time.
One time.
Alarm clock across the room. All right. What about waking up in the middle of the night? And does it say something about you if you wake up in the middle of the night?
Well, it's normal to toss and turn at night. We're all going to do that naturally. And you'll have awakenings at night, maybe about 20, but they're so brief you don't even remember them. But if you're waking up at night, sometimes that's an opportunity for your thoughts to intrude and start worrying about the things of the day. So that might be a problem. But also, waking up at night could be because of a sleep disorder, such as sleep apnea. You could have abnormal movements in your legs that are disrupting your sleep, or even medications. So there's lots of different reasons why someone will wake up at night. But typically, you go to the doctor and you say, I wake up at night. They tag you as an insomniac and write a prescription.
Yeah, they want to give you pills, right? Of course.
Right. And that's not necessarily what we want to see happening.
No, and Ambien makes you go to sleep. It makes you fall asleep. But unless you get that extended release Ambien, then you wake up in the middle of, right? I learned this on my trip to Russia because they were like, take a half an Ambien. And it makes you fall asleep, but then you wake up. You can wake up in the middle of the night just as easily.
Well, the half-life of Ambien is 3 hours. So half of it is out of your system in 3 hours, which means it's not going to be as viable as it might be earlier in the evening. And different medications have different half-lives. So doctors might prescribe different ones. Because remember, there's a lot of different flavors of insomnia. Yeah. Right? People think there's just one kind.
But the goal is to not be on a medication. The goal is to be able to have your body do what it's supposed to do. So can I ask you, does it mean something? I was once told that it means something if you wake up at 2:30 a.m. versus 3:30 a.m. versus 5:30 a.m., when you're trying to sleep. Is that true?
I've never seen any data that would suggest that it means something in particular, other than if you look at somebody's internal circadian rhythm, there are different rhythms that kind of crisscross, and there's a period of time in the middle of the night where you're actually going to have less ability to stay asleep, and so that's usually where that 2:30, 3 o'clock comes from. I have a lot of patients, interestingly enough, it turns out to be a blood sugar issue.
Oh.
So I ask them, well, what time was the last time you ate? And they say 6:30, 7 o'clock, and then I count it, and it's been like 8 hours, and they're out of fuel.
They're hungry.
Right. So a couple of easy fixes for that. One is, believe it or not, raw honey. So a teaspoon of raw honey a half an hour before bed, not if you're diabetic.
Or under the age of 1, right?
Right, you don't want that because it'll help keep your blood sugar stable. The raw honey, it's a little bit more difficult for your body to process. Or something, if you're not a big sweets fan, guava leaf tea. There's actually a study to show that it keeps your blood sugar stable at night as well.
Really? Yeah. That's a good tip. Now, what about, because we've all had the thing where we wake up for whatever reason, like your husband's too loud or something happens, and you cannot get back to sleep. Right? Yes. And so should you read? Should you turn on the TV? Should you just put on one of those sleepy stories that we just talked about? Like, what should you do?
You want to not toss and turn in bed. You want to guess. Don't clock watch. That could be the worst thing you can do because it just
reinforces it.
Don't look at the clock.
You immediately do the mental math.
Yeah, I only have 3 hours left.
Yes.
Right. It's like, boom, you can't stop it. It's like, it's terrible.
But if you're getting up in the middle of the night, try and do something relaxing. What I'll get my patients to do is start with their toes, think of your toes, and just go up from your toes all the way up to your jaw. You'd be surprised sometimes how much tension you have in your muscles that might be keeping you up at night. But if you can't sleep, get out of bed, do something relaxing, because all you're doing, if you're tossing and turning, is reinforcing that the bedroom isn't a place to sleep.
Okay.
So it's setting the cues that this is a calm, relaxing environment that I could maintain sleep in.
Because you can program your brain. When I see that bed, when I'm in this dark room, it does one thing. Well, two things, but
you do one of them more than the other. Right. So What Dr. Ash was talking about was interesting. It's called progressive muscle relaxation. So this is a technique that I teach a lot of my patients, and it's where you tense and relax muscles starting at your toes, going all the way to your head, and that helps get rid of that physical tension. But sometimes, and I don't know if anybody in the audience has ever experienced this as well, you can't turn off your brain.
Yeah.
Right? That's like the big thing that I hear
your
in my
thoughts
office.
are racing.
It's like on and on and on, because I'm an insomnia specialist, so I hear this quite a bit. So sometimes we use distraction techniques. That's what those sleep stories would actually fall into the category of prior to bed. But in the middle of the night, do you really want to be grabbing your phone, clicking on, the bright light comes on, it's like morning. Yeah. So one of the things I have people do is deep, what we call diaphragmatic breathing. So there's an easy technique. We can teach everybody how to do it right now. Okay. All you do is you breathe in for a count of 4, hold it for a count of 6, and then release for a count of 7. It immediately begins
4, 6, 7.
4, 6, 7 breathing. The Navy SEALs actually use it.
In for 4, hold for 6, release for 7.
And what it does is it lowers your heart rate. Most people don't realize it, but you need a heart rate below 60 to enter into a state of unconsciousness. And this is one of those ways that you can do that. And it really forces you to concentrate on the breathing, and you can't think of anything else. Yep. Boom. You're out.
You know why this is important? Because what people don't understand, insomnia is not a problem with the system for sleep. It's a problem with the system of wake. It's a state of hyperarousal. So when you're trying to fall asleep at night, if you have a problem with hyperarousal, it's like as if you had the foot on the accelerator and you're trying to come up with solutions to put your foot on the brake. You have to take the foot off the accelerator. And what these deep breathing exercises do, they actually turn on the nervous system for rest and digest and shut down the fight or flight system.
All right, I have so many other questions, including should you take a shower at night before you're getting ready for bed? Do you ever do that?
Yes.
And when you wash your face, should you be using cold water within 20 minutes of going to sleep? Much more to discuss right after the break. Don't go away. We're talking about sleep and answering some of your biggest questions. And here's the one I have for you guys. So when you get ready for bed, should you be taking a shower right before you go to sleep?
So there's actually data to show that if you mildly raise your core body temperature and then allow it to fall, it's actually a trigger for melatonin release, because that's actually what happens in our bodies currently. So sometimes for some of my patients, I do have them actually take a bath. And believe it or not, I like a bubble bath better, because the bubbles will actually stay across the water and keep the water hotter longer and act like insulation. So Mr. Bubble is good for sleep.
Wow. All right, can we talk about napping?
Napping is good.
Is napping good?
Well, see, the thing is, most of us have a lot of stress in our day. We have a lot of demands, childcare needs, or we have non-traditional work schedules that limit our ability to get these 7 to 9 hours, whatever the right amount is for you. So when you can't get the right amount of sleep, you obviously want to focus on getting sleep. It's really important. But when you can't, a 20-minute, no longer than 40-minute nap has been shown to really re-energize you. You want to not go any more than 40 minutes because you'll transition into deeper sleep. And when you wake up, you'll get that sleep grog and that feeling miserable.
Been there. So set an alarm.
And also, it'll limit the amount of sleep you can get at night. You only need so much sleep in a 24-hour period. And if you're paying your debt during the day, you won't need it at night. You'll be up tossing and turning at night. Okay?
So if you have insomnia, I would say naps are probably not a great idea. But if you have an alternative work schedule, you work shifts, or you're a mom or what have you, and you can catch a nap during the day, that can actually be helpful.
Do you set an alarm, 40 minutes? Because, you know, what happens, you set the alarm, and then you're lying there, and you're like, still awake, still awake, still awake. And then can you push it back?
But
40 from right now, from right now, from right now.
Right, but see, you could use your sleep stories, right, to start your nap.
Is that a real, like, are those legit?
So here's the deal, is they're a distraction, right? And they're a calming distraction. There's nothing wrong with a calming distraction in our lives. Our lives are so busy. You know, I always say it's no wonder that people have a difficult time turning off their brain, because at night when they turn off the light, it's the first time somebody isn't talking to them, right? And throwing information at them all the time. And so all these thoughts come piling in.
What about this? Is this real? Is this not going to help?
So, I mean,
a calming activity and
I think
nighttime routine.
I think what Ms. Henner was trying to talk about was finding your center.
Yeah.
So in a lot of yogic practices and meditative practices, it's about finding your center. And when you find your center, you can become calmer. And so I think that's sort of what she was talking about. Unfortunately, there's no real data on a particular position to put your hands to help you.
Last question. Is there a position, a magic position to sleep in?
It's whatever gets you through the night. Now, for some people with pain, they might find that they need to get pillows to prop them up. And one area where position is really important is if you're pregnant, you want to stay on your left side, but also if you snore. If you snore, side sleeping can eliminate the snoring, and it can actually help if you have a disorder called sleep apnea, where the airway will collapse at night. So in those cases, pain, pregnancy, and if you snore.
And also, Dr. Breus has a sleep quiz, right? That will help you figure out like what kind of a sleeper you are, and also once you figure that out.
So once you realize what type of sleeper you are, early bird, night owl, in between, or insomnia, we know how your hormones profile in a 24-hour period. And from that, I've actually got enough data to show you what the best time of day is to do almost any activity. Have sex, eat a cheeseburger, ask your boss for a raise, you name it.
Wow.
Yeah.
That's spectacular. All right, and you can check that out at today.com/MeganToday, which I'll be going to during the break.
There we go.
We'll be right back. Thank you both so much.